Hello everyone. In this video, we are going to talk and answer your many questions like when to start breastfeeding, how much we should feed, how frequently we should feed. So let us start. When to start breastfeeding? Have you heard about breast crawl? Breast crawl is the term given to the babies when the babies get delivered immediately, even before cutting the cord. The babies are put on the tummy, and what they have seen is they crawl towards the breast because they smell mother's milk and they are ready to suck. So this gives you answer, when can we feed the baby? As early as possible. So if you are delivering by normal delivery or vacuum delivery or cesarean, your baby is ready to suck. Now it depends upon you, when are you ready to start? So what is the ideal time? As early as possible, as I said. But because of the circumstances, because of your health, because you are exhausted, you may not be ready. What we recommend as doctors is within half an hour, if you are delivering normally, like maybe normal vaginal delivery or vacuum delivery, anything, so you can safely, simply feed your baby within half an hour. But by chance, if you have undergone cesarean, there are a lot of circumstances because you may not have been shifted from operation theater, you may be in the recovery unit. In cases of cesarean also, what we recommend as a pediatrician is that you need to feed within 2 hours. Within 2 hours, the first feed has to be given to the baby. So that is when to start. Now, next question is how long we should feed, how much should be the duration of breastfeeding. So the answer to that is how long you should breastfeed. As we discussed in the previous videos, is we recommend exclusive breastfeeding. Exclusive breastfeeding means breastfeeding only, not even water. Unless your pediatrician or neonatologist recommends, but in all the normal situations, your baby should be given only breastfeeds. So that is for how long you need to give is first 4 to 6 months. So ideally 6 months, but the range is first 4 to 6 months of life, your baby should be given exclusive breastfeeding, not anything, no medicines, no water. Medicines unless it has been prescribed by your doctor. Second is how long my baby should suck at my breast. As in the previous videos, we have told that once the baby learns the art of sucking, usually babies can empty the breast in 10 to 15 minutes. So babies should be sucking at each breast for 10 to 15 minutes. And after that, if you feel that baby is hungry, then you can switch to the other breast. Third question is that, as we said, if baby is hungry, babies can be sucking on one breast followed by other breast, depending upon the timing or his hunger or appetite. So that gives you answer to your second question. Third is how frequently we should feed. Should we go by the clock, as our pediatrician has told, every 2 hours we need to suck, or every 3 hours? So what should we do? So that is not by the clock. Your baby is the guide. Because why we say too early is first few days, just to say that babies, mothers may not be ready or mothers may not know that when does the baby want to feed, or they learn the art of feeding slowly as the time passes. So yes, we do say yes every too early, but that too early rule applies to special situations. So what are the special situations? In case your baby is a preterm baby, or your baby is a low birth weight baby, or suppose sometimes you have diabetes during pregnancy, your baby may be prone for low blood sugar levels. So in those cases, sometimes we become strict. Yes, you need to feed by too early clock. But otherwise, in all other normal situations, your baby guides. When should I feed? When do you give it? So we must learn to see what your baby is demanding rather than guiding him by the clock or by our rules. Now look at this picture. This is very, very important picture because every time we think that our baby is not feeding, what to do? Because just look at this picture. Day 1, what is the capacity of your baby's stomach? Capacity of your baby's stomach is just around 5 to 7 ml. That means the size of his stomach is like this, and it can accommodate only 5 to 7 ml. So if he sucks for 5 to 10 minutes, like he will definitely get 5 to 7 ml, which is enough actually. But most of the mothers, they become so stressed. He's not sucking, he's not feeding, but he must have definitely got that 5 to 7 ml of milk when he sucks for 5 to 7 minutes. That is good enough. And your baby grows at a very higher rate, magnificent rate. Once he crosses the day 3, the stomach increases to a size of a walnut. That means it can accommodate around 20 to 27 ml of milk. And after 1 week, he can accommodate 45 to 60 ml of milk. Is the size of an apricot. At 1 month, your baby's stomach can accommodate 80 to 150 ml of milk. So don't get worried if he is not feeding at a given time. You need to understand his cues. What are the things he's showing? What are the expressions on his face? What are his cry like? What does he demand? Try to understand his language. Then only you will know that whether I should feed now or I should wait for some more time. Our general instructions are usually when the child has fed, he will kind of either play or he will sleep for some more time. But the moment he passes urine or he passes motion, his stomach becomes empty. And then he is again ready to feed. But suppose you have fed just now, and after that also the child is crying, it doesn't mean that he is hungry. There are 101 reasons for crying. We need to slowly understand him, learn from him why he is crying. Every cry doesn't mean that child is hungry. So try to understand, try to talk to him, try to learn his language, and then we will slowly understand that whether he needs milk or he doesn't need milk. And of course, your baby is the boss. Baby will decide whether I want to feed or I don't want to. So that is all for today's video. In the next video, we are going to learn about troubleshooting, various problems, common concerns we are going to tell. Thank you.